I'm Cami Cloward. I'm the patient navigator in Atascadero, California for Aegis Treatment Center, and I've been working under the State Opioid Response Grant since we received it.
I'm Dr. Brian Tuller. I'm the Chief Medical Officer of Aegis, and I've been working for Aegis for about 6.5 years and working with the grant programs as well.
Awesome. Well, lovely to have you both here today. My first question is for Cami. And what has your experience been working with diverse populations within your community?
So for me, I have a background of working with CDCR. So that's California Department of Corrections and Rehabilitation, and working directly with parole. So it's allowed us to use those relationships that I had in the community to kind of bring in more of the diverse population into our clinic. And the grant opened up doors for us to be able to do a lot of harm reduction in the community, do a lot of outreach, and really build those relationships to be able to bring in the diverse community into our clinic.
What strategies specifically have you found to be successful in these efforts of bridging those communities together?
I think that the gap funding that we were able to use with the grant, so in a perfect world, those being released out of incarceration would have their health insurance, their IDs, all of that. Sometimes that doesn't happen. The grant allowed us to cover the cost of their treatment while getting their Medi-Cal and getting all of their proper documentation. So it was just building those relationships and letting the community know, hey, this is something that we can do because of the grant, and really being out there doing the education and letting people know about our services, where I think prior to the grant, we didn't have a big face in the community. So I'm able to be out there a lot, doing marketing and really just letting the stakeholders within the community know the services that we offer and the ways we're able to help.
That's awesome. I'm really glad to hear that the grant has helped you do that. Outreach is a big first step. So that's awesome to hear. And have you integrated any health equity policies into your program?
Yeah, we're constantly looking at different evidence-based practices that we can have the counselors use when working with our participants and with our clients. So it's something as a company that's important to us, and that we're really looking at how do we expand that, where do we integrate it into it. So it's just looking at the different practices and how to apply them to the patients that we serve.
And then specifically to Aegis, how have you identified diverse populations that can be treated or that should be outreach to within your community?
I think it's getting involved with the stakeholders in our community and finding out what the need is, and just meeting those stakeholders where they are, and really us being that not necessarily a box, and we'll kind of be willing to break through those boxes and kind of meet them where they are, figure out the needs within our community, and really do the research on how can we best assist other people in our community to get the services out there that we need.
And in doing that research and looking into the data of your community, have you used the UCLA data dashboard at all to help in those efforts?
I think for us, it shows us what kind of research and what kind of work needs to be done on the back end. So we're making sure that we're meeting the qualifications and that we're really understanding the needs of our community. So the dashboard's been helpful for us, more so on how do we better prepare ourselves to get out there in the community and do the work that needs to be done.
Awesome. So helping to identify the gaps to be able to apply and do the work. Awesome. With any new policies, there are challenges. Has there been any specific challenges in your efforts to implement health equity or DEI policies?
I feel like because we're such a huge company with so many different people from different backgrounds, we haven't had a lot of those challenges, because where I might fall short, I can get on the phone with a colleague up north and they may be able to answer those questions. So I think the fact that we are such a big company and we do work collaborative so closely, that we're able to figure out the areas where we needed to grow, and we're able to do it all within in-house.
And then my question I'd love to ask at the end of every interview is, what is your favorite part about working for Aegis or working with the Hub and Spoke System grant?
I think for me, this role, I've worked in the field for 11 years now. It's always been a real structured role where this role kind of lets me take everything that I've learned in the 11 years working in this field and kind of break down the walls and really do things with a different approach and brainstorm other ways we can look at treatment, because I think so often it's kept in a box and it shouldn't be kept in a box. So, at Aegis, that's one of the cool things is they're able to let us really figure out what needs to be done in our community. It's not a cookie cutter answer. What works in San Luis Obispo County may not work in Ventura County or LA County or wherever. So that's the cool thing about Aegis, is because we are so big that we're able to really tailor it for the needs of our community in the area that our clinic is.
Yeah, definitely. Well, thank you so much, Cami, for your sharing of your experiences today. So, hi again, Dr. T. And for you, what has been your approach as a provider to implementing health equity at your sites?
Well, as we said before, we meet the patients where they are. And so, since our clinics are located where patients live, and our staff members also live in those same locations, it just comes natural. We're able to understand the needs of the community, understand the needs that the patients have, and be able to meet those needs. And so it just comes naturally.
Do you have any health equity related pieces of advice for other prescribers?
Yes, early on in my career, it when methadone, the rules used to be that a patient had to fail methadone detox first. It was a 21-day detox, but for a pregnant patient, they could go directly into methadone maintenance because we're trying to get them stable as quick as possible. Right now they're trying to do away with the detox rules. But this was a while back, and I had a patient come in at 38 weeks, pregnant, and she was unfavorable, meaning that she had opioids in her urine, she had methamphetamine, and I was thinking to myself, because I was new, I was somewhat new, I was about a year into this, thinking, should I be admitting this patient at 38 weeks gestation? What is the OBGYN going to think when they look at this and say, what is this doctor doing? Why is he putting a patient on methadone at 38 weeks? Then I thought to myself, and I thought, well, where else is she going to go? She has nowhere else to go. So I admitted that patient, and to my surprise, 2 weeks later, the patient stopped using opioids and stopped using methamphetamine as well. And from that point forward, I realized I'm never going to hesitate again. For a patient that comes in who's maybe different than our other patients, a patient that's pregnant, very late term, I'll never hesitate again because that outcome that I saw, and it works out better for the patient and for the baby.
Wow, yeah, that's a great example of meeting patients where they're at and taking each case by case. Thank you for sharing that story. What has been the most rewarding part of being a provider at Aegis Treatment Center?
The most rewarding part is people coming in and they might not even be ready in the stage to change. But, you tell them it's okay. We're going to try to stabilize you. And then you're going to receive a lot of counseling. And trust me on this. Once you're stable, we're going to try to relieve your cravings, your withdrawals, and we'll go from there. But seeing a patient who had completely given up on life get back in life, become a parent, a child to their parents again, and just anything, getting back in the job force, that is really rewarding to me. Knowing that I can help somebody, get back into life, back into what we consider, normal life. But yeah.
Yeah, that's amazing. And the work that you two both are doing is truly inspiring and amazing. Thank you so much both for sharing your stories today and taking the time to answer some questions for us.